Patient with a cocktail of antibiotics. Listening to the whole cumbersome process, don't you think it's lengthy and tedious? Hence, the procedure, especially in clinics like vision centers and PHCs where a microbiology laboratory is not always available, this process becomes difficult and the treatment delayed. And that is where we need a point of care testing where it can be portable, lower cost, have faster processing time, and also reduce the sample volume. That's when we found IOLscope, an intraocular lens based microscope, a perfect innovation tool made with minimal resources for point of care diagnosis, especially for cases like corneal ulcer. In this video, you could see how an IOLscope is made using 4 intraocular lenses of 30 diopter lens attached to a chart paper with liquid adhesive and then attached to a smartphone to carry out examinations of microorganisms. Then we thought, why not make IOLscope specific to an ophthalmologist by attaching it to the slit lamp with a mobile adapter, also using a torch for illumination. So introducing you to Slit. As you can see in the video, the illumination part of the slit lamp is detached from the pivot joint and the smartphone adapter is attached to it. Once it fixes properly, we need to reattach the illumination part into the slit lamp. And this is the part of the adapter where the smartphone will be fixed. And here you can see how the joystick can be used to move up and down and sideways. You can use a torch for illumination, or we can even make your own illumination tube with any hand sanitizer bottle and a smartphone with a flashlight on. And once you keep the slide on top of this bottle, you can examine it with a SLIM. This video shows the application of SLIM in a patient with corneal fungal ulcer. The doctor can be seen doing on-spot diagnosis of the corneal scraping using the smartphone-based IOLscope and accordingly giving the appropriate treatment, which results in better patient counseling, faster treatment, and prevents delay of diagnosis. It is not always necessary to dismantle the illumination part. Pivot joint has an extension. It can be simply attached to that extension and the examination carried out. Hence, SLIM, an attachment of the IOLscope to the slit lamp biomicroscope, is an innovative, novel modification to an existing slit lamp, transforming it into a microscope. Hello everyone. I'll be talking about
Thank you.
I have a question. Your device seems to be quite good and innovative, but you have not shown any of the pictures of microorganism, how it appears on your device, like fungus and bacteria. So at least it should have some resolution, which is useful.
Yes.
So we have not seen that. So
Yeah, actually, the actual IOLscope, which was done previously, we have already. Sorry. We have already taken pictures, and we have also published the pictures which we have taken from IOLscope, and that is exactly why I didn't put it. We were more concentrating on the slim part, on how the attachment is, and we have even done a study of how sensitive this is. Almost around 92% of KH mount we were able to diagnose with fungus, and if it's a cultured medium, we have got 100% sensitivity on getting the high Fa. We also published three other articles on the same things of how IOLscope is used to diagnose fungal hyphae and parasites also. So no, sir.
How long you can keep these IOLs?
Unless and until there are some artifacts coming in those IOLs, we can actually use it numerous times.
In your experience, how long you have used?
I have been using the IOL which I used over here had 4 IOLs together, but with Orolab we have been able to get one single IOL with 120 diopters power. So that has been, I've been using it for 1.5 years. Yeah. Unless and until the optics gets bad, we can actually use it for a long time. Yeah.
So you can change the number of IOLs. Like you have used 4, you can use 1, 2, 3 depending on the power.
Yeah. Actually, the one IOL uses we actually use the one IOL thing with the 20 diopter lens for anti-segment photography, and subsequently I started adding more IOLs of the same power, and that is when IOL scope was made. So that has a collective diopters of 120 diopters, and then we designed a new IOL which is has this collective 120 diopters into one IOL, and we are using that. So you can depending on what magnification you want, you can actually increase the IOLs. But I've seen that when we use anything more than 4 IOLs, the distance between the sample and the lens becomes too small. So it was almost touching the sample. So that wouldn't be easy to take photos. But
and
4 IOLs.
How much is the gap you keep between the successive IOLs?
Almost,
they are not touching each other. There is gap between.
No, they are not touching each other. Almost like 3 millimeters. For this 4 diopters with 30 diopter lens, 4 30 diopter lens together had almost just 2 to 3 millimeters gap between the sample.
Between each lens?
Between each.
Between the lenses.
The sample slide and the sample slide and
between the sample.
Yeah. Between the lenses.
Lenses are close to each other.
Yeah. Or touching each other.
Touching each
other.
Yeah.
So one question.
Parallel to each other?
Yeah, it would better. Yeah, it better to be parallel, because then we always get a little bit of aberrations. So there is a lot of aberrations when we use 4 lenses together. But if we make it like how we have made it in one, this total magnification to one lens, it is giving less artifacts, less.
So how do you ensure they are parallel once you've glued them? How do you ensure that they are parallel?
Yeah, it is. It was just manually.
Can you use ready-made available lenses, photographic lenses for mobile cameras, like telescopic lenses and all? They are available ready-made.
No,
not telescopic,
no,
but other magnifier lenses.
Macro lenses are available, but that is it doesn't hold good for microscopy. Okay. Yeah, the total optics and the principle of optics totally changes when we use that kind of lenses. Yeah.
One last question, Prithvi.
90D lens. I don't think it will work, sir, because again the optics is a little different. For microscopy it is different. Maybe I'm not tried, because again we have to remove that whole sleeve, remove the lens separately, and keep it. I am not tried that.
Yes, ma'am.
Yes, last question.
Yeah.
I think since there's a limitation in mounting the number of lenses you are using, this would largely cater to seeing fungal hyphae. So when you have to see smaller organisms like microsporidia or something, which is what where this would hugely come in as an asset. I think we have a limitation. Or you will have to look at a single mount higher power lens.
Yes, ma'am.
So you cannot vary the magnifications as you have on a microscope.
Yes, ma'am.
That's what I understand.
Yeah. Okay. The magnification we can change according to the
by changing
diopter, but judging more smaller microorganism is a limitation
so for
right now.
fungal hyphae, it's a huge asset, but for something like microsporidia, then we
it's difficult. It's a little difficult at this point.
What about your interface on the iPhone, on the interface,
Yeah, that depends on your phone, which phone you use. I have been using a 5S, which costs around 6,000 at the market right now.
The interface itself would help you magnify well.
Yeah, that helps a lot actually. I have actually used a very basic phone, so that we can show people that it can be done with basic phones too.
Thank you so much.